Agreed. Like there may not be great evidence-based medicine that suggests that across big studies that these things work, but we certainly have seen them anecdotally. There is evidence in multiple studies that suggest that there may be benefit for these. So those are things that are worth trying for patients that they're really desperately trying to avoid a procedure to be done.
Hey guys, Dr. Reddy here with Dr. Smith. We have another episode of We Knows Noses today. So today we will be talking about how can we treat sinus problems in a patient that does not want a sinus procedure or sinus surgery. So sometimes, we'll have patients that might be candidates for sinus surgery or candidates for sinus procedures, and either they don't want a procedure or they medically cannot get a procedure, and they want to think about maybe out-of-box kind of solutions to potentially help with their sinus symptoms. So that's a pretty common thing that I see, especially because we see a lot of second opinion consultations for patients. We will typically see a patient that's seen another ENT doctor, and that doctor has recommended a sinus surgery. And then the patient comes to see us and they ask, hey, is there anything else we can do maybe to avoid a surgery? And we'll kind of go over options. You're going to get started on that?
The first thing I always have when I have a patient that comes in with like a second opinion and they were recommended sinus surgery is to really clearly make sure that that patient has what we consider maximal medical intervention or medical therapy. And that really can run the gamut. So if you look at like what maximal medical therapy is from like an insurance standpoint versus what truly is maximal medical therapy, they may be different. And there are sometimes that certain therapies will work for one patient and may not work for another patient. And so it all comes down to one, education with the patient and discussion to make sure that we understand that a lot of times when sinus surgery is recommended, it's because there's a chronic underlying problem. This is something that's been going on for months and months and months, not days or weeks or even up to a month. It's typically these are issues that have been going on slowly over time. And what I always tell patients is the difference between a chronic sinus patient is that a chronic sinus patient has an issue with the self-cleansing mechanism, right? So their self-cleansing mechanism in their sinus isn't working. They now have a change in the biome or the bacterial envelope or environment that's within the sinus. And so the biggest thing that we need to do, which is what helps keep the sinuses healthy to begin with, is get air into the sinuses and get mucus cleansed and out of the sinuses. So there's a bunch of different things that we have in our kind of armor that we can try to get the aeration better in the sinuses or the mucus production to assist with the self-cleansing mechanism of the sinuses. And so the one thing which I know you guys have heard and talked over us talk about over time, but nasal steroids, right? So, I have a lot of patients that say, oh, I use nasal steroids I use Flonase and it didn't work. Or I use Flonase, it didn't work. I use Rhinocort, it didn't work. And so nasal steroids are great. They do work and they're often effective and safe to use for long periods of time. But getting them up into the sinuses can be a really tricky conundrum. Like, how do you get the nasal steroids up into the little passageways that really need the anti-inflammatory activity? And so delivery of steroids, but also letting patients know, like, hey, this is something that you may need to stay on even when you're feeling well. Because a lot of patients with chronic sinus symptoms or chronic sinus disease have episodes where they feel pretty good. They go on an antibiotic and a steroid and the inflammation cools down and they feel pretty good. But the self-cleansing mechanism and the underlying sinus health is still there. And so patients need to first understand that often a nasal steroid is a prolonged treatment, not just a short-term treatment for chronic sinus disease. And so nasal steroid sprays, like the traditional sprays, are great, but there are even better ones out there. We can do nasal steroid deliveries in irrigations and rinses, like the sinus rinses. We can use nasal steroid deliveries in these exhaler delivery devices, which right now there's Xhance, which is a fluticasone delivery system that helps more aerosolize. So assuming that you've tried all these different things and your doctor's been working you up appropriately and you've failed all these things, there are other things that we can do that are a little different or outside the box that can also help. Dr. Reddy, do you want to talk about some of those things?
Yeah. So just to recap, this is a typical patient we get that's seen other ENTs in the past and doesn't want surgery, right? And it's coming to us for another opinion. And so out of the box things that we can try. So first, we can try compound rinses. So compound rinses are typically made up at a compound pharmacy. So the typical CVS and Rite Aid or Walgreens don't usually make these compound formulations. But what you can do is you can have the patient use a sinus rinse that has saline in it, just like a normal sinus rinse, and you can add whatever medication you want on top of it. And these can include things like antifungals, antibacterials. There's even antivirals, and you can add medication that helps called mucolytics that break mucus up, and all sorts of other things even. Now, technically, these medications, these compound medications, are not FDA approved. However, a lot of them have been studied, usually individually in different ENT studies, and they're taught to be relatively safe. The efficacy is controversial with some of these things. Many people think the irrigation is probably more important than what's actually within the irrigation. But anecdotally, I think we've had some success where we've had some patients that were miserable and weren't candidates or didn't want surgery, and some of these things may have helped them over the long run.
Yeah,
do you have anything to add about the compound rinses at all?
No, I think that's perfect. Just a delivery. And sometimes we can even do like a culture in the nasal cavity with an endoscope in the office, and sometimes get those compounds kind of tailored to what bacteria may be evident in your sinus cavity.
Yeah. Do you ever have the patient make a compound rinse themselves at home? Do you have them do that?
Yeah. So I'll have patients sometimes make their own rinses. I may even have them add, in addition to that, things that are like detergents within the sinus cavity. So, it seems like a little crazy, and patients often look at me like I have two heads, but I'll often recommend even baby shampoo. So I have patients use like Johnson & Johnson baby shampoo.
Yeah.
Have them use some, very small amount into the rinse, which can help detergent. And the thought is, back to some of the previous discussions over past episodes about biofilms, it may help kind of break up some of the fats and lipids in these biofilms that keep these bacteria kind of held up in the sinuses.
Yeah. Any other alternative, out of the box, maybe wacky things that you've recommended to patients?
Yeah, either seen or recommended. In the past, I would have thought like rinsing out the sinuses with like betadine solutions would be crazy. However, in looking at research and having patients having done these in the past, these bactericidal or bacteriostatic agents such as betadine can help in very low dilute quantities, help kind of reduce some of the bacterial burden within the sinuses and the nasal cavity. Even like gentian violet can be helpful, which is a very old school topical treatment back used into the old World War time frame to help kind of sterilize wounds. It can be used topically to coat sinus cavities. And then I think it might have been you that actually saw that one of the new packing materials for post-sinus surgery
has some gentian violet in it. Yeah. Yeah. It seems some of this stuff might seem a little voodoo, and it might be, but there is some evidence that some of this stuff works. And for patients that are desperate and don't want to, have an intervention, if you try some of these low risk things, it might be helpful. Another thing that's gaining in popularity that's also controversial is breathing techniques for sinus issues. There's a book called Breath by James Nestor. He wrote a New York Times bestseller, very, very popular with some of our patients. A lot of our patients actually have read this book and come seen us. I myself have only skimmed part of this book, but there may be evidence that different types of breathing techniques might improve some of the ventilation in the nose and the sinus issues in your nose. But again, this stuff has not been proven in randomized clinical trials.
Now, it had to do with the nitric oxide release in the tissues, which you had mentioned in previous episodes as well,
Exactly.
which has some bacteriostatic principles as well.
Correct.
And you'll even see rinses on the market now with these more natural antibacterial principles. So I know do you have patients that use any of those, the rinses with the sugars that are...
Yes. Yeah. I'm not familiar with some of the details with it, but there's all sorts of things out on the market. Now, some of the stuff you may have to be careful with what you get, especially online.
Right.
But generally speaking, most of this stuff, if it's mostly with saline, it's probably relatively safe.
Yeah. And so you'll see those xylitol.
Xylitol,
those xylitol components as well that may have some antiseptic or antibacterial principles within them. But yeah, agreed. Like there may not be great evidence-based medicine that suggests that across big studies that these things work, but we certainly have seen them anecdotally. There is evidence in multiple studies that suggest that there may be benefit for these. So those are things that are worth trying for patients if they're really desperately trying to avoid a procedure to be done.
Yeah. What about other things, lifestyle related, like diet, sleep position, and stress levels? What do you think about all those things?
Yeah, those are
sinus issues.
Those are absolutely great points. And stress levels is one thing that I often harp on, but I don't necessarily always talk about diet and exercise as much as I ought to. But stress is a huge thing, and as you know, stress can change cortisol levels in the body to make you less apt to fight off infections or bacteria and viruses as well. And so in patients who have recurrent sinus disease, sometimes getting more viruses makes them more susceptible to more chronic flare-ups and infections. So all of those things, as you mentioned, are extremely important in improving sinus health.
Yep. And sometimes, sleep positions might be helpful. If you sleep with your head of your bed elevated slightly, if you sleep on your back, sometimes the sinus passages may potentially be able to be drained in a more natural way, because your sinuses are supposed to drain into the back of your throat and you're supposed to swallow it. So gravity can kind of help a little bit if your head of your bed is elevated and you're laying on your back as opposed to on your stomach for some people. And diet, right? So there's more and more evidence coming out that there's some portions of a diet that can be more pro-inflammatory. And so if you have a diet that's more anti-inflammatory, then there's a possibility at least that your sinus inflammation might be less as well.
Yeah, histamine-rich foods may cause more inflammation in the nasal cavity, especially if someone's already predisposed to have a histamine problem.
Anything else to add?
No, I think you hit all the great points.
Very good. Well, we'll catch you guys on the next episode. Thank you.
Take care.